Hi guys, and welcome back to my channel. My name is Alicia Darlene for those of you that are new. I do a bunch of videos. These videos are just about my pregnancy journey. So this week I'm going to be talking all about pregnancy in week 30. So if you've been following my YouTube channel, you know that I started these videos at week 6 and I am planning on doing them all the way up until I give birth. Now that we are getting closer and closer to baby's due date, it is a little bit harder to do these videos just with like time and fatigue and all that stuff. If you are currently pregnant and you're watching these videos along with me, then you know exactly what I'm talking about being just tired and having less and less time. I feel like it's a time crunch now until baby comes. I'm pretty excited to finally be at week 30. I feel like it's a pretty big milestone to finally get there. If you are not at week 30 yet, you can go back and check out all my other videos I have. Like I said, I started at week 6 all the way into 30. This is my second baby. I have a 1.5-year-old little girl and we are expecting a baby boy this time around. So pregnancy has obviously just been super different than with my first, with like fatigue, morning sickness, just how I feel now these last couple of weeks. I mean, everything is just completely different. I feel him move so much more than I did with Avea. I did feel Avea move, of course, but this little guy, I feel him move so much more strongly and more powerful that sometimes it even starts to hurt when he's just moving so much. And I feel like I can feel his foot in my stomach, and then he kind of like will drag it across, and just like a whole bunch of different stuff that I am feeling this pregnancy. Speaking of, I think he just kicked me right now, probably because I'm talking about him. But yeah, so everything is just super different this time around. They say every pregnancy is going to be different. So let's just jump into week 30. If you haven't already, please like and subscribe to my channel so I can keep making a bunch of videos for you guys. Not only do I make videos about my pregnancy journey, but I also make some just about like breastfeeding, what I'm gonna pack in my hospital bag. I did that video for my first. I think I'm gonna do a video just what I'm gonna pack this time around to see what changed, what stuff I needed and didn't need for that first time. So I'll probably do a video on that, just a bunch of toddler stuff. So yeah, if you haven't already, just go to my page and check it out, all the other videos that I have for you guys. Okay, so like I said, I'm pretty excited to finally make it to week 30. That means we are like so close, 2/3 of the way there. At week 30, baby is about 16 inches long and about 3 pounds. So getting pretty big, putting on some more weight. Of course, baby's just gonna be getting heavier and more chubby these next couple of weeks. I mean, baby could come anytime between 37 and 41 weeks is usually about the time. They say that if you're a first-time mom, that you will probably go to your due date or you'll go a little bit over your due date. But if it's like your second or third, that they'll come a little bit faster. So I'm just trying to remember that for this one. I'm trying to see, if he's gonna come early, if he's gonna make it all the way to the due date. I have no idea. I'm super big right now already. So I'm like just hoping that I don't go into preterm labor or anything like that. I just want to get to at least 38 weeks because we had Avea at 37 weeks and it was perfect. We didn't have to go into like a NICU or anything like that. So I'm hoping that we just get there with this one too. So like I mentioned, I'm feeling huge already. I don't know if you are yet, but at this time your baby bump has expanded very quickly. Your belly is increasing size is a big clue that baby's just getting bigger and bigger. So roughly they say that baby's gonna be putting on about 1/2 pound per week for the next 7 weeks, and then the weight will kind of stay the same. So just know that baby's gonna be packing on some weight these next couple of weeks. So if your lower back is already starting to hurt, I suggest getting a pregnancy belt. You can talk to your provider about this actually, because I got one at my appointment. I just mentioned that I had some lower back pain already and they gave me a pregnancy belt. It may or may not be covered with your insurance, so just have to check on that. But it's like a belt. I'll probably show it in the next video, but it goes underneath your stomach, you Velcro it, then it's like this big girdle. It Velcros here, it kind of lifts your stomach up, so it's pretty nice. The only downfall about wearing it is like it makes your stomach stick out even more because it's like lifting it up. You can pretty much see it. I know that they say like you can wear it underneath your clothes, but I pretty much just put it over my clothes and wear it at home. And then the only thing is you have to take it completely off and put it completely back on every time you have to pee. So that's like the only downfall. If I know I'm gonna be on my feet all day, I'll definitely wear that. So that's something to look into if you're already getting that low back pain. So at week 30, you only have 10 more weeks to go. You're so close. At this time, you're also in your 7th month, just to know exactly where you're at. So at this week, your baby is making melanin. I don't exactly know how to pronounce it, but it's just like the pigmentation of your baby's skin. They'll most likely get its color when they come out, so they don't really have a color yet, but your baby's skin cells are pretty much just making that pigmentation, so when they do come out, they have that skin pigmentation that they're gonna have. So if this is your first baby, I know it's a little bit overwhelming to know exactly what you need, like absolutely need, when baby comes. So just know, as long as you have diapers, wipes, clothes, a car seat, stroller, and not necessarily a crib yet, you can still have like a bassinet, you should be fine. You don't need to get all the expensive, crazy other stuff that you see on like people's like baby registry, stuff like that. That's like at the minimum, that's what you would just need, is like the clothes, diapers, wipes, car seat, stroller. If you're gonna be, you know, taking baby out, which I suggest a stroller, and the crib or bassinet at this time. Usually the bassinet is good for the first couple of months of baby. It's a good idea to start packing your hospital bag. Like I said, I'm gonna make that video too, just so it's ready to go in case anything was to happen. And also within the next couple of weeks, you wanna think about installing your car seat. So you wanna have that already ready to go. You're not rushing to do it at the last minute. You're not doing it at the hospital parking lot. That one's just ready to go and you feel confident that it's there, comfortable that it's there. So that's something to also look into if you haven't installed your car seat yet. So baby is surrounded by the amniotic fluid. There's about 1.5 pints of amniotic fluid that is cushioning your baby. And they say that will peak, the amniotic fluid will peak around 34 to 36 weeks. So at this time, baby can also see in the dark, just like when you have your eyes closed and you can kind of see if someone turns a light on, it's really, really dim, but they can start to see those lights and those shapes already. And his pupils are already constricting and expanding, so that's pretty exciting. So at this week, lanugo is probably starting to disappear. If you haven't heard what lanugo is, it's pretty much just like a little bit of hair all around baby's body. It just kind of helps them regulate their temperature, just because, like I said, they haven't gained weight yet, so they are starting to gain weight at this time to help them with body temperature, so they're starting to shed that lanugo. Still might be birthed with it, and it just kind of like hair along their body, but they'll definitely get rid of that. So another big change for baby at week 30 is your baby's bone marrow has completely taken over the production of red blood cells. So before, tissues and the baby's spleen was in charge of making those red blood cells, but now the bone marrow is completely taking over. So that's really, really, really good for baby, especially just to have them thriving when they are born, but they are taking care of all that good stuff at week 30. Okay, so let's talk about mama now, how you're feeling. Like I mentioned at the beginning of the video, you're probably feeling fatigue. If not, you know, props to you. I'm glad you're not feeling that yet, but for me personally, I've been definitely dealing with the fatigue this week. Not only along with fatigue, but also feeling like I can't catch my breath as much. You know, my diaphragm is just a little bit more squished, I guess you could say, as baby's getting bigger. Just shortness of breath, especially if I do something like more vigorous or something, I'll kind of lose my breath. At night, what I'm having to do is kind of prop myself up with pillows just because it's more comfortable. So if you're getting to that point also where you're kind of losing your breath and stuff like that, just make sure that you're resting. Just know that it's gonna get better. I mean, it's only for a couple more weeks left, but at night, just to make sure that you're really comfortable, if you can, try to sleep on your left side and prop up with those pillows. One of the nights I've already slept like in the living room just because it was more comfortable, because I could kind of sit up more and then prop my body around with pillows. So just, like I said, just get more comfortable. There's a bunch of stuff that you can look up, like position wise for bed, or you can just put as many pillows around you as possible, which I've also done too. But yeah, that's something that you'll probably be dealing with if you haven't already. I know this one that we've all heard about is growing feet. So the ligaments actually in your body are relaxing, and the ones in your feet can actually grow. Unfortunately, they will not go back after birth. Like most of these symptoms, you know, you hear about the stuff going back to normal after you give birth, but this one, unfortunately, it does not. So if you do experience that your feet are growing, just know that that's probably going to be permanent, and you can invest in some new comfortable shoes, and you might have to get rid of the ones that were already snug on you before, because they probably won't fit you anymore if it's something that you're dealing with. So with Avea, my first, like I said, I had some growing feet. I grew about like a half a size, nothing too crazy. I could still pretty much fit into all my shoes that I had before, but if, like I said, the shoe was kind of already snug before, there's no way that it fits me now. So I kind of had to donate some of those shoes, but it wasn't a huge difference for me. So hopefully it's not for you either. So what I'm really wearing now is just like really comfortable flats. You just have to look for the flats that have a lot of cushion, not the ones that are super flat like flip-flops, because those will start killing my feet. It's just gonna be harder to put on like those lace-up tennis shoes. If you can slip them on, then that's perfect, but just try to invest in some really comfy flats that you can easily slip on and off, like I said, that have a lot of cushion on the bottom. So that's something you can start looking for. No matter what season you're in, the flats will still look good with like leggings or jeans, and you can put them on easy and take them off. So last thing we have to talk about for week 30 is just mood swings. So just know that it's a combination of uncomfortable symptoms and hormonal changes. So it's just a bunch of stuff going on. So if you feel happy, then sad, then anxious, I mean, this is something that pretty much all mamas go through. So just know that you're not alone in that. It's okay to feel anxious if you're gonna be a good parent, if this is your first baby, if you are running around trying to clean and organize, that's just called nesting, which we've talked about before as well. Just trying to get ready for baby. If you're just fatigued and you just want to lay there all day, I mean, if you can, I would say rest, because I feel like some days of the week I am so energized and I want to go and organize everything, and about 2 hours in, I'm like, okay, I'm done. Even though I had all these plans of what to do for the whole day, what I wanted to organize, what I wanted to clean, sometimes I just don't get there, and it's kind of not really frustrating, but just kind of like, darn, I had all these plans I wanted to do, and I just really have to just listen to my body and not overdo it, so then I'm like really hurting at the end of the day. So just be aware of that sometimes you just have to listen to your body and rest. But yeah, just know that those mood swings are pretty normal as well. Some moms do get a little bit depressed or anxiety, so if that's something that you're dealing with, you can also talk to your provider about if it doesn't go away. But that pretty much wraps up for week 30. A whole bunch of exciting stuff. So like I said, it's a pretty big milestone that I was excited to get to, and I'm happy that you got there too. So let's just keep pushing it along. Like I said, we only have 10 more weeks to go. Could be a little bit sooner, could be a little bit later. So I hope this week is good to you, and we'll see you in the next video.